You might not truly understand what blood pressure actually is. Well, consider it like water going through a garden hose. When the end of the hose is open, water flows freely. But when you put your thumb over it, the water is restricted and the pressure builds up. And that's when problems happen. Put simply, blood pressure is the force at which your heart is pushing blood through your arteries. Hi, I'm Dr. Ishola. I'm a cardiologist with the Florence Walmart Heart and Vascular Institute at St. Elizabeth. Having the appropriate blood pressure is one of the biggest keys to leading a healthy life. Without a healthy blood pressure, your organs can become damaged over time, leading to many conditions that can impact your health and even result in death. But don't worry, I'm here to take a few minutes with you to learn more about blood pressure and how to manage it. The heart pumps out blood. Blood pressure is the force that moves blood through the body. Oxygen and nutrients are pushed around the circulatory system to nourish your tissues and organs. So blood pressure is actually the measurement of the systolic and the diastolic blood pressure. The top number called the systolic blood pressure is when your heart contracts, and the bottom number called the diastolic is when the heart relaxes. Guidelines set by the American Heart Association and the American College of Cardiology says the normal blood pressure is around 120/80. You want your top number to be around 120 and the bottom number to be less than 80. There are two major reasons for high blood pressure. One is genetics, the other is lifestyle. When we talk about genetics, we're talking about things that run in families. When we talk about lifestyle, we're talking about preventable factors. There's issues like diabetes, there's issues like obesity, there's issues like alcohol and drug use. So one of them is preventable, the other is more of just familiar issues that run in families. Essentially, yes, it's more of a conversational difference. High blood pressure is probably the term most people use and are accustomed to. The term hypertension is, however, more precise. There is no one-size-fits-all for checking blood pressure. It really depends on your current medical history and your risk factors. For example, if you have a family history of hypertension and you've been diagnosed with pre-hypertension, your doctor may recommend you check it maybe twice a week or even more. If you are taking medications for high blood pressure, you may need to check it daily. At very least, everyone should have their blood pressure checked at a yearly checkup with their primary doctor or once in a while every few months. Absolutely. Especially if you're on medications or trying to manage your blood pressure. It is helpful to track most of your numbers at home to help improve the overall management. The last thing you want to do is to make medication changes based on your doctor's visit only. We do know that a lot of people have white coat hypertension, which can kind of mask the actual blood pressure control. So checking at home gives us a really precise estimate of where your blood pressure is, which helps us to optimize your blood pressure medications. Hypertension at the beginning stages are usually without symptoms. However, as the disease progresses, people develop different symptoms. Some of the symptoms we notice in patients are regarding things like palpitations, shortness of breath, strokes, or even bleeding. Some people present with shortness of breath. It really depends on the organs affected overall. So the key component is the initial stages you have no symptoms. By the time you do develop symptoms, the disease has really progressed significantly, which is why we termed hypertension the silent killer. Absolutely. Especially in the American diet, the one thing we know is high salt intake plays a major role. So food that has a high salt content will make your blood pressure difficult to control. The second factor is we do know that food that has a high potassium content makes your blood pressure better to control. So food like banana, spinach, and kale has been shown to improve blood pressure control. Another major component is the fact that food that has high contents of carbohydrate makes your blood pressure difficult to control because your kidney tends to reabsorb more salt when you have high carbs. So in summary, I would say one is you want a low salt diet. You want a diet that is also high in potassium if possible, and you also want to reduce the carbs in your diet. Absolutely yes. We know that smoking drastically increases your blood pressure. In essence, they vasoconstrict and increase the stress in the blood vessels, which makes it very difficult to bring your blood pressure down, despite medications. So if anyone is serious about bringing the blood pressure down, you have to stop smoking. One is having a very active lifestyle. We know the sedentary lifestyle has been shown to make it difficult for your blood pressure to be under control. Two is your diet. Fast food is the enemy. Fast food has a lot of salt content and high carbs. So cutting down fast food has been shown to really help your blood pressure. And lastly, smoking. We cannot have good blood pressure control if we keep smoking for the reasons we've talked about, especially the vasoconstriction of the blood vessels. So in summary, I would say smoking, diet, and having an active lifestyle are the three things I would recommend for good blood pressure control. Thanks for taking time to learn about your blood pressure. Check out the other segments from the St. Elizabeth Take Time for Your Heart program to discover more tips on lowering your risk for heart disease.